everybody, Dr. Wendy here. Thanks for checking in for another episode of The Whole Truth. I am so excited about our topic today, and I have a special friend of mine here to share all of her insights and expertise. So Alina White is my guest today, and we are going to be talking about something called vaginal rejuvenation. So Alina, you have got such extensive background and knowledge and expertise in all the areas of plastics. Can you tell the viewers what your background is and all of your certifications?
Absolutely, Wendy. I'm a registered nurse and I'm the clinical director for Dr. John Ayala, and I've been in plastic surgery since 1998. And I'm a member of the American Society of Plastic Surgery Nurses. So
amazing.
I love this specialty.
You are amazing. And Alina is the person that I contacted after I got my fat transfer to my face done because I was so swollen and terrified, and I knew it was going to turn out fine, but Alina had so many tips that helped to calm down the swelling and the bruising and really helped me heal faster. So she is such a fount of knowledge, and thank you so much for being here.
It's my pleasure, Wendy.
But today we're talking about plastic surgery for the vagina. And if you have not heard about vaginal rejuvenation, you may not have stood in the HEB line or turned on the television in the past year or so because it's everywhere. They're talking about it on all the shows, The Real Housewives, The Doctors, all the magazines, from Cosmo to Women's Health to Men's Health. Everybody is talking about vaginal rejuvenation, and there are a lot of reasons why. One of them is, of course, because we are an aging population, and our plastics friends have perfected the ways to help our faces look younger, our cleavage, our décolleté, and our hands, but they weren't really doing that much for other areas of our body, which show signs of damage and trauma and wear and tear. So as we get older, people want to look and feel their best their entire body, not just above the neckline. So vaginal rejuvenation describes a whole field within plastic surgery that can involve surgical changes to help improve the vaginal health, but we are going to focus on some of the more regenerative therapies, which I think are so much better than surgery and can do amazing things with no healing, no downtime, and incredible results. So share with me some of your thoughts about some of the things and the ways that vaginal rejuvenation improves vaginal health and function.
Absolutely. So Wendy, one of the issues that we have with not knowing too much about this particular subject is the fact that it's very intimate, and for some, if not most women, it's a little embarrassing to discuss, and we don't realize that as we age, whether we gain weight, we put a little weight from, pressure on the vaginal wall, loss of elasticity, childbirth.
Absolutely.
I mean, just a list of things that, take place, the thinning of the wall because our estrogen levels thin out. Hormone changes, dryness.
Yes.
And the most important one is to be able to feel good about yourself when you're being intimate with your partner.
Yes.
So in that, in itself, when you are not able to feel comfortable to be able to just, make love to your husband and feel uncomfortable because you've lost the sensation or you feel like, oh my gosh, am I pleasing him? Or are things normal?
Or if you're having pain.
Or you're having a lot of discomfort. I mean, that dryness, discomfort, and not being able to climax.
Absolutely.
Is huge.
This is why we want to talk about this, because it is kind of a taboo subject. Like you said, people don't feel comfortable talking about it, even in the gynecologist office, when I would love nothing more than to talk all day about sexual health and how to improve that and maintain that as we age. But these things that Alina mentioned happen, and they can happen even at younger ages. You spoke about all the common causes, and I am so glad, because childbirth being one of the most common, the stretching, having large babies, it causes damage to that area. And sometimes people don't heal completely. They may have pain, they may have nerve damage that prevents them from having sensation while they're having intercourse, or prevents them from being able to have orgasms. And these are very important functions for women to maintain.
Even when they work out, a lot of them come and talk to us and say, I just am tired of when the minute I just strain a little bit, I have an accident.
Thank you. Bladder weakness.
Yes.
One of the most common problems. It affects between 30 to 50% of women beyond the age of late 30s, and it gets more common as we get older for all the reasons that Alina mentioned. And vaginal rejuvenation, done with lasers and radio frequency and PRP, can help to restore the vitality, the elasticity, the muscle tone. It can make things tighter. It can restore the nerve function for women who just can't feel very much down there. And it can improve their ability to have better orgasms, stronger bladders, and to not only feel good about themselves, but to function and have satisfying relationships with their partners.
Absolutely, and having an amazing OB-GYN too, because sometimes patients don't recognize it. And being able to not only just talk about the procedure and the rejuvenation aspect of it, but adding an expert to discuss how they are able to maintain this treatment through hormones.
Absolutely.
Even if it's vaginal creams,
compounded
creams, and stem cells and PRP.
Yeah,
Oh my gosh, you know.
We have got so many things that we can offer patients to help them maintain or reclaim, fix what may be broken. So I wanted to talk a little bit about all these different modalities. So Alina has got a fabulous modality at Dr. Ayala's practice. Tell us a little bit about the Femme Touch, right?
Oh yes, the Femme Touch. So one of the things that patients come to us and ask is, gosh, I don't want to be under.
Yes.
I don't have the time to be down. I have to pick my kids up. And for those who don't have children, they have this fabulous career, and they don't have the downtime. I'm
go
sure.
through a surgery,
yes, to go through a
and
surgery
6
and
weeks of recovery.
And so Femme Touch is a laser. It's a CO2 laser. And what it does is cautiously burns the inner lining of the vaginal canal. And what that does is that injury, and it's a controlled injury.
Yes, it is.
So when you hear burn, don't think it's going to be like this massive injury.
Does not hurt.
And most of them
Painless.
say it's painless.
Yep.
It helps to shrink the tissue, but along the injury, it also helps to stimulate the collagen.
Yes.
So that stimulation of collagen thickens the vaginal wall. And it's so important because it's like regenerating new vaginal tissue. And so not only do you stimulate the collagen, but you stimulate circulation.
New blood vessels.
New blood vessels.
Improved muscle tone.
Absolutely. And so we actually recommend 3 treatments. And along with the vaginal rejuvenation, I think we haven't discussed a little bit about the exterior aspect of the
vulva.
Yep,
The
there you
vaginal
go.
tissues.
The labia majora
Yep.
and the labia minora, which sometimes it atrophies with age or, you know, with childbirth.
Yes.
And so we're able to improve the appearance, you know, of that area along with the CO2 as well.
Yes.
And so it can be done also, which is highly recommended to be done with an O-shot, the P-shot, and also PRP to be able to stimulate and heal that tissue that was cautiously injured to be able to get the best result.
This is what I'm so passionate about regenerative medicine, because here we're talking about real healing, because the changes that happen to the vagina inside and outside can happen from weight loss, childbirth, whatnot, and rather than us, you know, cutting something off or doing other things that are not so regenerative, all we're doing is helping give your body the stimulation to heal itself. So new blood vessels, new collagen, new nerve supply, improved fatty tissue, and it's important. A friend of mine, Laura Galvan, another aesthetic expert, sent me a link to an article talking about how women going to spin class can experience a lot of pain and discomfort, and so that is actually something that's an impetus behind women wanting to have vaginal rejuvenation, to have the tissues tightened or shrunk or maybe modified slightly. But again, as soon as we start talking about surgery, you're talking about pain, about anesthesia, about the expense of the hospital, about your deductibles, and about a prolonged recovery and not a guarantee of outcomes. So I'm a surgeon, I love operating, but I am the first one to tell people what your success rates are, and your downtime is going to be significant. And sometimes after surgery, as you know, people will have some damage to the nerves and then pain. Scar tissue and unwanted outcomes. But the CO2 laser is fabulous. So I'm going to share, like, I got to have a treatment done when they were demoing the product for one of our other offices. It was completely painless. It literally took about 5 minutes, and there was no downtime. So 48 hours was what they recommended. Tell me if this is correct or not. It was Tammy and Warren. No intercourse. Like, you couldn't have sex for 2 days.
So for us, with this treatment, it was 72 hours.
Okay, perfect.
72 hours, and no baths, no
Yes.
soaking, pool, lakes.
Yes.
And also allow yourself a week to go through some dryness,
Yep.
too, because of shedding some of that
Yes.
damaged tissue.
Yep. And healing.
And healing, yes. And we give you thorough instructions on what to do
know you do.
afterwards, and it's so painless.
Yeah.
I have taken care of women in their 20s, 30s, 40s, 60s, and 70s.
Good for you.
And they are so
Happy.
pleased and happy.
Yes.
They're like, oh my
It's
gosh,
so
I get
wonderful.
their husbands too. They're
Yes.
like ready to pay and
Right.
take care. Please help us, you know,
Yes.
because not only is this affecting the woman, but the spouse wants
relationship.
their wife to feel better
Absolutely.
about themselves and be
Yes.
able to, hey, if there's something out there that's available
Yes.
that's going to be able
Right.
to help our relationship
Yes.
intimately,
Yes.
you know, worth it.
Absolutely.
Priceless.
I agree 100%. And so I think these technologies are fabulous. At our practice, we offer a Thermiva treatment, which is a radio frequency treatment, which has got excellent research and excellent studies showing improved muscle tone, improvement in bladder control, can be used to improve the clitoral function. And I've gone to meetings talking about CO2 lasers and radio frequencies where you just hear patients just glowing. And I love that you mentioned 20-year-olds, because women have children early on, and sometimes things are just different afterwards, and we can help them
Yes.
heal and reclaim that aspect of vitality and sexual health, and that is critical. Do you guys offer Oshots at your practice?
So we don't offer Oshots, and I primarily refer them to you
Thank you.
because I love to have our patients have a relationship with a specialist,
Yeah.
especially an innovative person like yourself,
Yeah.
you know, because I feel like the O shot and the P shot is very intimate, and you want to make sure you have an expert, you know, to be able to help address the issues, because like I've said before, I mean, these are topical treatments that we can recommend,
Yep.
but some of these issues stem from a much, much deeper level.
Yes.
And we need to make sure that we also have a conglomeration of
Yes.
specialists.
A multidisciplinary specialty.
Multidisciplinary specialty,
And
yes.
the patients feel comfortable talking with Alina or with me, because I will be honest, a lot of patients that I see have been to multiple doctors who never addressed it or who kind of dismissed their concerns. And these are not minor concerns. If it impacts how you feel about yourself or your functional status, that is very important and not to be ignored or dismissed by your doctor or practitioner or provider. So we just want you to know that there are people who are comfortable talking about this and knowledgeable about the benefits, the minimal risks, and how everything works. So Oshots are utilizing PRP, platelet-rich plasma, which is a component of our blood. So when we're doing PRP for rejuvenation, which can be done in conjunction with the CO2 laser or with the Thermiva to kind of like just hit it as hard as possible and try to get the best regeneration as possible. We draw patients' blood, so it's their own blood, centrifuge it, and then it separates into two fractions, the red blood cells and then a translucent clear yellowish component called the plasma. And within the plasma are contained growth factors and cytokines and signaling messengers that can be injected, again, without pain, into the walls of the vagina and into the clitoris to help regenerate nerves and blood vessels, to help restore function, tone, tightness, elasticity, bladder control, orgasmic function, and these are important. I don't know if I'm sure you're probably familiar with, but there's a lot of research talking about how maintaining an active sex life actually promotes health and longevity.
Oh my gosh, absolutely. In fact, when I had this particular patient that I love our patients. I'm sure you feel the same way.
Absolutely.
And we had this amazing patient who in most circumstances, you know, they bring their husbands.
Yes.
And it was so beautiful to hear her convey how she wants to still make sure that she pleases
Of course.
her husband, you know. And the minute that difficult topic was brought up, both the husband and the wife were so excited,
Yeah.
you know, and I mean, these are people that have
Yes.
been married over 40 something years. We're
Yes,
talking
that's
about,
beautiful.
you know,
Right.
subjects that are
Taboo.
real.
Yeah.
And they're real and they're taboo.
They're very
and
important.
to see,
Yes.
how excited she was after
for
the
her.
first
I
treatment.
bet she was. Good
And
for her.
they were so excited
Yeah.
to come and see you too.
They're
It was just so
precious.
beautiful. Yes.
Yes. So it's super important for them to maintain a healthy relationship with each other. And a lot of people just assume that as you get older, you just lose your drive and don't really care about it.
Who
And
has sex when you're older?
they should. They absolutely
Yes.
should.
Yep.
And some of the studies have shown, these are small studies, of course, but things like people who have sex more frequently as they get older have 30% higher levels of an antibody called immunoglobulin A, which helps to fight infections. They have got men who have sex more than 3 times a week, have got, in one study at least, a 50% reduction in the rate of heart attacks seen in that group. Some studies have shown that people who have sex more frequently live longer, 3 to 8 years longer, and this is my favorite, of course, for us. People who have more active sex lives look 5 to 8 years younger than their actual age. Like, oh, perfect.
Yes.
Yep, that's a win-win situation. So I'm all in on that one. So these therapies are important, and we want people to feel and to be confident and be happy and maintain their sexual health along with the rest of their health through all stages of their life, whether they're a 20-year-old who had a really difficult delivery with childbirth and has lost their sensation or has pain afterwards, whether you're a 50-year-old who's going through menopause and is experiencing dryness and friction and tearing pain, or whether you're an 80-year-old or a 70-year-old who just is totally in love, or maybe a new relationship and you want to incorporate sex into that relationship. Alina and I can help you, and we can talk to you and share with you all of our knowledge. So thank you so much for tuning in. We appreciate your attention, and you can contact Alina at Ayala Plastic Surgery.
Thank you, yes.
I mean, everybody wants to look like Alina, right?
Thank you.
And we are happy to help you with any of your health and beauty needs.